Hello learners and welcome to the last video of chapter 13 where we're going to focus on blood glucose and then diabetes mellitus. So first let's talk about blood glucose regulations. Remember, blood glucose is going to be all about our homeostatic cycle, specifically a negative feedback loop. So yes, we're going to be talking about a stimulus, a receptor, and then a receptor going through an afferent pathway to the control center. From that control center, once everything's processed, it's going to go through an efferent pathway to an effector, and then of course that's going to produce a response and or action. So yes, you will need to know how to regulate your blood glucose when you have an increase as a stimulus, the increase in blood glucose, and also a decrease in blood glucose. So we have an increase here, and we'll have a decrease down here. Let's go ahead and focus on the increase in blood glucose first. First, what is going to be the stimulus? Well, an increase in blood glucose. So more glucose in the blood itself. That's going to trigger some cells in the pancreas where our receptors are. So receptors are going to be beta cells in the pancreas. These beta cells, again, are going to say, hey, there's an increase in blood glucose. We need to be able to send this through an afferent pathway to the control center. And guess what? The pancreas is also the control center. And we talked about the pancreas before. We said that the pancreas is the endocrine gland that's going to secrete insulin and glucagon, right? So when it comes to insulin and glucagon, they are going to help us with regulation of blood glucose. But we also talked about cortisol when it comes to blood glucose as well. So cortisol is released by the adrenal glands. And that cortisol, because it has effects of stress on the body, it can also raise blood glucose as well. All right. So the stimulus, increase in blood glucose, receptor is the beta cells within the pancreas themselves. The control center is the pancreas, so an afferent pathway to the same area. So it's going to be straight in the pancreas itself. Now what's going to happen? The pancreas is going to tell these beta cells to release insulin. What is insulin going to do? Insulin is going to lower blood glucose. So again, the control center is the pancreas. The effect is the beta cells are going to release insulin. Now, what is going to be the response or action? Well, the response is going to be, well, what does insulin do, right? How does it actually work? First, it's going to stimulate glycogen formation in the liver. So we have the liver here, and that insulin is going to force the glucose that's already in the blood to say, hey, go ahead and form some glycogen and store it in the liver. Also, you're going to have some cells that are going to take on some of that glucose as well. So it can be cell uptake of glucose and, of course, storage as glycogen in the actual liver. And because of this, that's going to help us decrease the blood glucose level until it gets back to a normal range. So again, we have our little seesaw here. As you can see, when everything is good and it's in homeostasis, it's level. When it's out of balance, that means we have to make sure that we have a particular loop that's going to get it there, whether it's positive feedback or negative feedback. When it comes to blood glucose, it's going to be negative feedback. All right, if we talked about the stimulus being an increase in blood glucose, let's talk about the stimulus being a decrease in blood glucose. So again, your blood glucose levels is going to be very low. That's going to stimulate alpha cell. These alpha cells are going to act as a receptor. Now again, you're thinking I'm going to go to an afferent pathway to the control center, but again, the pancreas is the control center as well. So the pancreas is going to have those alpha cells basically release glucagon. That's going to be our effector there. It's going to release glucagon. What is glucagon then going to do? What's going to be the response or action? Glucagon is going to stimulate the breakdown of glycogen that's stored in the liver. That glycogen is going to be broken down into glucose. The glucose is going to go into the blood, and now you're going to be back to a normal blood glucose level. So as you can see, when we're thinking of our insulin and our glucagon, they do have sort of antagonistic responses to blood glucose. But their whole goal is to maintain homeostasis. So the beta cells are going to maintain if you're trying to get back to homeostasis with an increase in blood glucose, and glucagon is going to maintain if you're trying to get back to homeostasis with a decrease in blood glucose. So they have the opposite effect on blood sugar. Again, insulin decreases blood glucose. Glucagon increases blood glucose. How do they do it? Well, beta cells are released. Beta cells are used to release insulin to decrease blood glucose, and alpha cells are used to release glucagon, which is going to raise our glucose. Okay. Now we also can have hormonal interactions that are synergistic. So think about glucagon. Glucagon's goal is to release blood or increase blood glucose levels, right? But remember, we also talk about cortisol that has the ability to both raise, to also raise blood glucose levels. And so that can be very hard. If you're thinking, hey, I need to raise my blood glucose levels, but they're also raising because I have a lot of stress that I'm going through. That can also have a lot of effects on the body as well. You don't want to have a constant situation where your blood glucose is continually raised. And no matter how you try to get it back into homeostasis, it won't go back in homeostasis. That's where we get into the realm of disease. And that's what we're going to get into next when we talk about diabetes mellitus. Okay, folks, let's go ahead and focus on diabetes mellitus, which is going to be a focus on the hormone insulin, okay? Now, if you have the absence of insulin, that gives you a certain type of diabetes. If you have a deficiency in the effects of insulin, that also gives you another type of diabetes. So diabetes type 1 is basically an autoimmune disease, and that means you don't even produce insulin in your body. So if you can't produce insulin, you have no ability to decrease blood glucose when you have a rise. Also, we have type 2 diabetes mellitus, and type 2 diabetes mellitus is about insulin resistance. A lot of times it's just saying your cells don't respond to insulin properly. And if insulin is a hormone, it needs the receptors on the cells to be able to say, hey, send this message, do this, do that. Sometimes those cells are covered in fat, and that means that you're going to have a blockage between the receptor and the insulin themselves. That can be an option. Fatty liver disease can also be an option, right? But either way it goes, you're going to have insulin resistance because your cells can't respond to insulin at all. Now, you'll see I gave you a link in the module to new research on type 1.5 diabetes, okay? And the link is given. I want you to also think about that. Of course, our course is going to focus on type 1 and type 2, but it's just interesting extra information if you want to learn about type 1.5. Okay? Now let's talk about some similarities when it comes to diabetes mellitus. If we're focused on insulin, we know that both are going to result in high blood glucose or hyperglycemia, okay? So because that's a rise in blood glucose and there's nothing to kind of mitigate that, you either would have to take insulin on your own through a quick pen or something like that if you have type 1 or type 2. Type 1, you have to take insulin for the rest of your life. Type 2, you also will take insulin for a long period of time if you can get your diabetes under control. But you also have the ability to reverse your diabetes if you have type 2. But the most important thing is both are going to increase the risk of long-term complications. So things like neuropathy or weak signals of reaction potentials, which is going to cause a lot of numbness and tingling, which is why a lot of folks end up losing limbs. Heart disease, stroke, kidney failure, because you're urinating so much, and also your vision. So think about it. If you have a lot of a lot of sugar in your blood, the sugar is going to be crossing the capillaries in your eye and kind of scratching the sides of those capillaries. And over time, that could cause vision deformities. Now, I do want to talk more about how type 1 is basically diagnosed. A lot of times it's going to be early childhood or adolescent. Most of the time you don't see adults who have type 1 automatically unless you're thinking of 1.5, which again is not our focus, but again I gave extra research information on that. Now type 1, you will see that that's in children, so that automatically they can be taking insulin so they can produce or they'll be taking insulin directly so they can actually produce insulin to decrease their blood glucose. When it comes to type 2 diabetes, most of the time it's adult onset. That means it's based on your weight, usually obesity. It's based on how you eat, and it's really about environment. But new research is showing that it's starting to be more common in the young folks because more young people, we're talking like 7th graders, 8th graders, right? They're also starting to have a lot more obesity factors, and therefore they're going to have a lot more type 2 diabetes, okay? Now let's go ahead and get into some common signs of diabetes. I love this little infographic in your textbook, which is like the consequences of diabetes mellitus. And if you have a decrease in insulin, all these different things can happen. I'm going to focus on some common signs of diabetes. Number 1 is going to be polyuria. Then we'll talk about polydipsia and then polyphagia. So polyuria means that you have an increase in urine output. So you have a decrease in your blood volume because you're peeing so much, right? You're going to end up having a decrease in your blood volume, and you're also going to feel a lot of dehydration, okay? Now, guess what? That dehydration means that you're going to have excessive thirst. And so you're going to always be drinking water and increasing your water intake. So it's kind of a catch-22 there, right? You're increasing your urine output, decreasing your blood volume, but you're also now increasing your water intake because you're dehydrated. And then we also have polyphagia, and that means you're going to have an increase in appetite. The way this works is that you really will have excessive hunger and food consumption. That means you're putting a lot of glucose there's a lot of glucose in your body that your body can't use. And so what happens is your body ends up breaking down fat and protein to kind of stimulate appetite. And so it's this vicious cycle. It's like I'm always going to have increased blood glucose if I'm dealing with insulin problems. So what's going on here, right? And that's going to be one of the main things as well. And again, you can also see many other signs and symptoms. but a lot of times it's going to be more late stage diabetes. Another thing you can think about is the effects on the beta cell. Type 1 diabetes, you basically have a destruction of beta cells. So you have issues with your beta cells with type 1, right? It's really destruction. And when we're talking about no insulin production, sometimes you have a tiny, tiny bit. It's not enough to make a huge change in your blood glucose though. Type 2 diabetes, because of that obesity, for example, you start seeing a decline in your beta cells. So they even can stop producing insulin as well. So you can even get that worse. So we want to keep that in mind as well. Let's look at our infographic a little bit more. You have a decrease in insulin. How's that going to affect your tissues? Well, again, you're going to have a decrease in glucose uptake of your overall tissue. So again, the insulin cannot communicate with the cells. Your liver is going to break down glycogen into glucose. So you're going to increase your blood glucose no matter what. And because your cells can't uptake glucose, again, your blood glucose is going to be increased. Skeletal muscle is going to start breaking down proteins. And again, the liver can convert amino acids to glucose. And again, that's going to cause your blood glucose to be very, very high. So this means you can also have glucose in your urine. So a lot of folks with diabetes, so I always say that their pee smells sweet in some kind of way. Or if you go to the doctor and get a urine test, your urine sample, you'll see that there's going to be glucose or sugar in your actual urine as well. Because of this, you can have polyuria or polydipsia, okay? Now, also, we have a situation where, again, because the skeletal muscles are breaking down proteins, you also can have fats that are going to be breaking down as well. That's going to cause an increase in appetite. It's almost like I have so much blood glucose, huge blood glucose levels here, but since they can be used in my body, I'm always going to feel like I'm never satiated at that point. So that's where that excessive hunger comes in. Okay? Of course, you can go through as many portions as possible, but remember, you want to have some idea about what type of common signs for diabetes or the pathway for it, if you like, because you will be asked questions about diabetes on the next exam, and you want to make sure that you at least have an idea of some common signs of it and be able to explain. So, okay, polyuria, increased urine output, decreased blood volume cause dehydration, which then causes polydipsia, which is going to make you feel very thirsty and want more water. And this is a vicious cycle that folks are going through. Another thing we can talk about when it comes to type 2 diabetes is fat. Visceral adipose tissue. Adipose is fat tissue. Visceral means that it's going to be surrounding your organs. And so because it's surrounding, it's the fat around your organs, little differences can happen. It's not fat that's stored in your body, they're around your organs, so they can't actually release inflammatory chemicals. And let's think about it. If they're releasing inflammatory chemicals, then that also can cause additional acids as well. And guess what? Your insulin and your beta cells can't keep up with that. So you're going to have even more increase in insulin resistance. Another thing it does is alter metabolism. Because you're always excessively hungry, that's going to change how your body processes and breaks down food, because again, you can't decrease your blood glucose. So it's going to promote even higher blood glucose production by the liver. And it's a catch-22, like I keep saying, and it's just a horrible disease to have, but it really is a catch-22. One thing that you can think of when you're going to the doctor is, number one, if you have or know somebody with diabetes, number one, try to get them on a continuous glucose monitor. Probably the cheapest one, whatever you can, if they don't want to stick their fingers or forget to stick their fingers, because again, you'll be able to see your blood glucose at all times. That is within the time frame. Most blood glucose monitors you can keep on for 10 days. So every 10 days you will have to change it, but that's better than pricking your finger. Another thing that is kind of not talked about is that miscommunication between the cells. So if the cells can't see the receptors to be able, if that insulin hormone can't get down to the receptor to send a message throughout the cell, then guess what? You're going to continue to have increased blood glucose. So a lot of times folks are only focused on getting your blood glucose levels down, which is important, but the underlying issue here is going to be fatty fat, okay? That could be fatty liver, and that even can progress to different diseases, but also fat in general. So losing weight is going to be something that's important, and also making sure you're eating a certain diet and keeping those blood glucose monitors, and of course, checking your sugars by using that blood glucose monitor to make it easy for yourself. If there's something that folks don't really think about, they're like, oh, I'm going to go on a keto diet, for example. And you go on a keto diet, and then you realize, okay, you're eating a lot of fats because, again, you're feeding your brain fuel. And sometimes it works for some folks on diabetes, right? You lose weight. But it just depends on what stage. Like, of course, if you have type 2 diabetes and you know it's linked to your obesity, eating more fat can be an issue, okay? Now, of course, some folks don't even eat olive oil or avocado oil, which is healthier fats. And so that even cause even more issues. If you have processed or trans fats, that's going to cause even more inflammation responses in the body. Okay? So the main thing to do would be go on short walks or try to have that continuous glucose monitor or a system for yourself to prick your fingers, details like that. Make sure that you are trying to mitigate the amount of fat that you're taking in and also do some exercising. There's even research that's coming out that strength training and actually, lifting weights, it could be a 5-pounder, a 2-pounder, it doesn't matter. That can also help with, again, using up blood glucose, using up glucose in the blood, right? For energy and also helping strengthen in the body. And of course, once you are in a portion where you can actually be in fat burning mode, then that will also help lower fat in your body as well. All right, folks. So again, you could go and get research about type 1.5 diabetes. I posted a link for you. I think it's an NIH article. And I hope this helped, and I hope to see you in the next chapter. Okay? Bye-bye.